before knowing that I was going to get pregnant, because once the fat's removed, it's removed forever. Whether you have another kid or not, it's not going to change the fact. So I personally don't feel like you have to wait for lipo. I don't do consults on Saturdays out of my office. I'm a doctor's office. I'm not open on Saturdays. Just like if you got to go to see your family practice doctor, you take some little time off work and you go to your doctor's appointment. Tell your job you have a doctor's appointment and come to the doctor's office and get your consultation. But I don't work Saturdays. Hi, Farron. Thank you, Christina. You know, my skin, I'm feeling some type of way about my skin because since I'm pregnant, I can't use all of my good stuff. And so my skin is going in reverse. So thank you for the compliment. But my skin is not what it normally looks like. This little girl is like trying to take my pretty away. My skin is not what it normally looks like. And every day I'm like, but thank you, Christina. I'm originally from Cleveland, Ohio. Thank you, Victoria. All right, y'all. So I made the point I want to make. Liposuction is real surgery. Be careful. Don't let just any old body do it just because you think it's not a big deal. It's a huge deal, and it can kill you. And people do die from liposuction from people who are inexperienced. My consults are $150, Shawana. If your BMI, if you're a few points off with your BMI, then it's cool to go ahead and consult because it's usually only like 10 pounds or something. But if you are way off, so my BMI cutoff for liposuction is 33. If you're like a 38 or 39, you may as well wait until you're down to like about a 35 before we consult. Yes, you can get liposuction of the neck. I do it all the time. I use Zeo Skin Health products on my face. And I do vampire facials and stuff like that to my face. Thank you, Melinda. I'm normally on at 10 o'clock, 10 p.m. Denise. Because, Yolanda, you have veins everywhere. There's blood vessels all over the place. So it's not, you can't sit there and just ultrasound everywhere. There's like, you can't, it's not, that's not practical. It's just not that simple. Yeah, it's not that simple. There's veins everywhere. There's millions of vessels in our bodies. Like, they're all over. No, I don't work in Ohio. I'm from Ohio. I live in Atlanta right now. I'm from Ohio. I thought you were just asking where I was from. I'm originally from Cleveland, Ohio. I live in Atlanta, Georgia right now. My practice is in Atlanta. If you want a consultation from Illinois, we can do a virtual consultation. It's safe to do tummy tuck and lipo if you're not lipoing the central abdomen. There's a lot of doctors who will do both at the same time, liposuction of the central abdomen and a tummy tuck, and that has a much, much higher complication rate. And the complications that you get when you get that, when you have those two procedures together, are bad. So I don't recommend it and I don't do it. I won't do liposuction of the central abdomen and a tummy tuck on the same day. But you can get liposuction of your sides the same day and, other areas. But if you need lipo and a tummy tuck and liposuction of your central abdomen, we stage it. We do it in two surgeries. My skin products are good for all skin types. If a person has cystic acne, depending on the severity of it, we might have to do other things other than just products. But those products, that product line is good for like everything and all skin types. No, it's not safe to say you should get cool sculpting if you're 20 to 15 pounds away from your goal weight. I can't tell you if you can get cool sculpting or not, if it's a good idea without seeing you. Like, these things are for general information, but it doesn't like it doesn't take away the fact that you still need to be consulted with to pick the right thing, because it depends on how your fat distributes. So if you have a ton of fat on your belly, you might be close to your goal weight and you might have little arms and legs, and people usually have fat that's disproportionate in an area. And if you're super fluffy on your belly, you could be skinny and still not be a good candidate for it if you have a lot of fat in one area, and then it'll end up costing you $15,000 to get enough cool sculpting to make it completely go away. It might be better for you to just get lipo. So I can't say that without seeing you. Like, you can't really skip the consultation process and making a good decision for yourself. Anybody can, well, I ain't gonna say anybody, but having PCOS, you can still be a good candidate for lipo. That doesn't affect anything. Vampire facials are $850 in my office. If you've had previous surgeries, it depends on what you're planning to get. It will determine whether or not I want to see the old op notes. And like, if I'm operating in the same areas, then I will probably want to see the old op notes. But it also depends on what you got. Like, if you just got lipo, I wouldn't really care to see the old op notes. But if it was like something more in depth, then I may want to. It just depends. Downtime for lipo is a few days. It's really not. You're sore, but you can go on about your business. Yes, you swell a lot with liposuction, and you have to wear compression even when it's on your neck. There's no guarantee with anything, Yolanda, and it's certainly not going to be a guarantee with cool sculpting. And I certainly can't tell you a guarantee without seeing you. Sorry, honey. Yeah, you're sore from lipo, but the more you sit around, the more sore you feel. It's just like a rigorous workout. When you sit around, you get more stiff and more sore. You just move. Like, all of my lipo patients are like up and at it in 3 days. Some people like milk the whole surgery thing like way too much. I see some of the stuff I see, I'm like, seriously? Like, people they're doing all kind of stuff. You're not sick. And the more you lay around, the more you increase your risk for complications like blood clots. Get up and move, keep it moving. Thank you, Shawnetta Newburn. My office is in Johns Creek, Georgia. I get vampire facials about every 6 to 8 weeks. It's not vampire surgery, it's a vampire facial. My blood is drawn, it's processed, and the platelet-rich plasma is separated out. It's got stem cells in it, growth factors, all kind of good stuff, and then it's needled back into my skin. Swelling is caused by having surgery. Like, it's inflammation and your body trying to heal everything. And the way to avoid it, you can't avoid it, but to minimize it is with compression garments and lymphatic massages. The amount of fat that can be removed with lipo, there's not actually a straightforward answer for that. Different states have different guidelines for a maximum amount. I pay attention to how much blood I'm getting out with the fat, and even if I haven't reached the max amount, that, for me, if I've lost a certain amount, if the person's lost a certain amount of blood, I'm stopping. So I'm not going to sit there and be like, oh, well, the max is 5 liters, but I'm seeing you're losing a lot of blood. I'm not going to take out 5 liters. Like, that's crazy. So it really just depends. Anticoagulants increase your risk for complications also. So an anticoagulant can make you hemorrhage, which can kill you. So a blood clot can kill you and a hemorrhage can kill you. So that's the thing. Everybody thinks there's just like a easy fix to everything, and it's just not. Medicine is plastic surgery is medicine. It's very complicated. The body is complicated. There's a lot of moving parts. There's a lot of things to consider, and that's why you need a good ethical doctor doing your work. Yes, bruising with liposuction is normal. You can't avoid it necessarily. I don't accept insurance, Victoria. I don't take any insurance. Dip hips. Dip hips. You mean you got like dents in the side? It could be filled in. If you have like dents, then it could be filled in with fat transfer or Sculptra or something like that. Yeah, your hemoglobin needs to be in a normal range. All right, y'all, I'm about to I don't take care credit. Me and Care Credit didn't get along. I don't take Care Credit, and I'm not ever going to take Care Credit. I take Alpheon, United Medical Credit, and Lending USA as of right now, but I will never ever take Care Credit, ever. I don't like them. So I'm going to log off. Thank you guys for joining me. I will be back on maybe tomorrow, maybe the next day, but it'll be at night. Well, unless I get something done on my face tomorrow. If I get a treatment done on my face tomorrow, I'll go live during the day and let you guys see it. But I am Dr. Myla Bennett of Ederra Bella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me via my website, www.ederrabella, EDERRABELLA.com, or you can inbox this Dr. Myla Bennett page with your phone number and email address. Once again, my consultations are $150. They're not free, but the cost of the consultation will come off the price of your surgery if you decide to book that day of your consultation. Really, that's it. If there's something you want me to talk about, go ahead and drop it in the comments, and I will see you guys soon.